COVID pandemic, it has made its rounds already now, and it has been the talk of the town for a really long time. But it has also really exacerbated this very challenging situation with wound management in the community setting. Now, during the lockdowns, we really saw a lot of disruptions in wound management, in wound treatment due to missed visits. The risk of infection and exposure to COVID transmission, it made it a very tough balancing act between understanding who required urgent care and who could be actually triaged away. Now, overall, this conundrum, what it really did is that it persuaded a lot of practitioners and patients to accept telemonitoring as a care model. This was one of the outcomes that we really saw from the COVID pandemic, right? And this is sort of illustrated in this study that we have. And in a survey of 18 European wound care specialists, which was conducted between March 2020 and January 2021, it was found that COVID had really, as expected, it pushed a lot of people to adopt telemedicine for wound monitoring, right? Patients also were more likely to accept the fact that they needed to take responsibility for their condition. They needed to understand what was wrong with their own wounds. And because of this, they were more compliant and they understood how to navigate a lot of the scenarios behind their own wound care challenges. Now, on the flip side, however, this survey also uncovered that some patients were discharged prematurely, and as a result of this, the hospitals had even more referrals for readmissions. Now, this also expected, some delays and disruptions in the care, and it certainly led to quick deterioration and even more urgent need for specialist care. Really, one of the big things to note with the impact of COVID-19 on wound care was that there was a lack of accurate assessment, right? And this was one of the big reasons as to why the issue of readmission, the issue of delayed, disrupted care was quite significant. Now, disruptive as COVID has been, the lessons learned really make for good teaching, right? As Winston Churchill once said, right? Never let a good crisis go to waste. The technology from telemedicine to artificial intelligence, it has long been available, and right now it is already mature and it's ready for us to use it in a wider arc. And what we find is that it is now the time, right? Really for us to align the right care models for teachings, trainings and workflow. We need to align all of these things to create a sustainable change as to how wounds can be managed more effectively in the community setting.